Coming up next on KPBS Evening Edition, why are U.S. banks ending wire transfers of money to Somalia? We'll hear from a San Diego man who visited the famine-ravaged country to deliver aid earlier this year.
And a faster way to get across the border opens to mixed reviews. KPBS Evening Edition starts now.
Good evening. Thanks for joining us. I'm Amitha Sharma, in for Joanne Farian.
And I'm Dwayne Brown. Today, House Republicans rejected a plan to extend a Social Security payroll tax cut and long-term unemployment benefits.
And if the House Republicans refuse to vote for the Senate bill, or even allow it to come up for a vote, taxes will go up in 11 days. I saw today that one of the House Republicans referred to what they're doing as, quote, high-stakes poker. He's right about the stakes, but this is not poker. This is not a game.
Now, San Diego lawmakers voted along party lines today. The state's Employment Development Department says about 584,000 people in California will run out of benefits this week. In San Diego, more than 145,000 workers were unemployed in November.
Secretary of the Interior Ken Salazar today approved a wind project in southeastern San Diego County. The Tule Wind Project will be located 70 miles east of San Diego in the McCain Valley. The project will produce enough electricity to power up to 65,000 homes. The project still needs additional approvals from the California Public Utilities Commission, Bureau of Indian Affairs, California State Lands Commission, and San Diego County. The project is expected to create 337 jobs.
A new political party will appear on California's presidential ballot next year. Secretary of State Deborah Bowen says Americans Elect turned in more than 1 million signatures to secure a place in the June primary election. The Washington, D.C. group wants voters to nominate a bipartisan ticket and challenge the dominance of the Democrats and Republicans. It is the first new political party to be added to the California ballot in 21 years.
More than $14 million in federal funding is coming to San Diego County to aid the homeless, part of $236 million to support homeless programs in the state from the Department of Housing and Urban Development. Kyla Calvert has more information about how the money will be used. Kyla, will this money support new programs or existing ones?
This was an announcement of the renewal of existing grants. So this money is going towards supporting ongoing programs, existing transitional and supportive housing across the county. Two of the largest grantees were the St. Vincent de Paul Villages and the San Diego Housing Commission. And St. Vincent de Paul got just over $4 million, which supports about 900 transitional and supportive housing beds, and the Housing Commission got about $2.5 million, which supports about 200 beds and several other supportive services.
So it's going to go a long way. Now, a recent report from the Department of Housing and Urban Development showed a decline in homelessness across the country. Is that also true in San Diego?
Actually, nationally, the rate of homelessness declined by about 2%, and in San Diego, it actually increased by about 1,000 people. Those numbers come from what's called a point-in-time count. There's one night in January where volunteers sort of fan out across counties across the country to count the number of people sleeping on the street and the number of people who are in emergency or transitional shelters. And so in San Diego County, last January, they found about 9,500 people, and that was about 1,000 more than the year before. And nationally, they found about 636,000 people.
Okay, thank you for that report, Kyla. More people than ever are skipping the trip to the mall and opting to do their holiday shopping online. Online sales nationally are up 14% from this time last year. While the trend is growing, online sales still make up only 15% of the total holiday haul. Overall sales for both brick and mortar and online retailers have been better than expected this year. The National Retail Federation projects they will top more than $450 billion.
The new Ready Lane for drivers traveling north from Mexico into San Diego opened today. It's intended to reduce wait times for anyone carrying high-tech enabled ID cards, but as we saw today, it may take a while to improve traffic at the busiest border crossing in the world. The new ready lanes are expected to shave 10 to 20 seconds off the wait time per car. The average wait is about 1.5 to 2 hours during the morning and afternoon drive. Joe Meisenhelter is the U.S. Assistant Port Director.
Anyone with the new RF documents, the radio frequency documents, can use this lane. So anyone with a U.S. passport card, a Century or Trusted Traveler card, or an enhanced driver's license can use it. And also for foreign travelers, the new resident alien card has them, as well as the border crossing card.
Ready lane means the traveler is ready with their information before they arrive at the officer's booth. Here's how it works. When it's your turn to drive through the lane, hold all cards up on the driver's side of the vehicle. Then a brief stop at the officer's booth, and you're on your way.
This is to do two things. One, to provide for security, to make sure we're able to do the checks and know who's entering our country, but also to be more efficient at what we do and a faster processing for the general public.
We got mixed reviews from motorists waiting to cross into San Diego today. Alejandro Correa was hoping his 2-hour wait would be cut in half.
It's going to be an hour and a half.
You've been waiting that long?
Yeah.
Really?
Yeah.
Customs officials say the wait time at the Otay Mesa port of entry has improved significantly since they installed ready lanes in May. The average wait there, about 45 minutes.
Yesterday, we told you about a bill in Congress aimed at combating illegal border tunnels like the ones found in San Diego County over the last month. Today, a San Diego County resident was sentenced to 14 years in federal prison for conspiracy to distribute nearly 14 tons of marijuana that arrived in the U.S. through Mexican border tunnels.
More than 30 needy families received holiday gifts today during the Salvation Army Kroc Center's Adopt a Family event. The center's Maria Todaro says more than 600 families signed up for holiday assistance this year, and the 33 with the highest need were adopted by individuals or businesses. She says those numbers have been steady through the recession, but are much higher than before the economic downturn. U.S. banks are ending wire transfers of money to Somalia. A San Diego man who recently visited the famine-ravaged country joins Amitha to talk about it at the Evening Edition Roundtable.
San Diego has the second largest number of Somalis in the United States. Many of them regularly send money to family back in Somalia, where a 20-year civil war has decimated the economy, and this summer's famine has killed thousands. But local Somalis say sending money home is now in peril because the last bank in the United States that handles money transfers to Somalia is ending the practice. The bank says court cases involving Somalis giving money to the terror group Al-Shabaab have made the transfers too risky. But local Somalis think the decision was too hasty and put thousands of Somalis in their home country in jeopardy of starvation. The one country that can't seem to catch a break is Somalia. For 20 years, the country has been racked with civil war. This summer, it was hit by a famine that killed tens of thousands of people. And now, what is believed to be the last bank in the United States that still allows wire transfers of money to Somalia, a crucial lifeline, is ending the practice at the close of the month. Joining me is Abdi Malik Bool. He's the head of the San Diego Somali Youth League. Abdi, tell me, it's estimated that Somalis in the United States send upwards of $100 million to Somalia each year. San Diego has the second largest Somali community in the country. Describe how vital is this money to people in Somalia?
Well, thank you for having me on the show. It is the most vital lifeline for most families, actually, because as the families immigrated here in the early 90s, they left a lot of their loved ones back home. So because of that, the only lifeline for most back home is the remittances that are sent from these wire transfers from the diaspora, which are the people located outside the country.
So Franklin Bank in Minnesota is deciding to end these money transfers. They say, look, it's too risky. We've had 2 women in Minnesota who've been convicted of sending money to the terrorist group Al-Shabaab in Somalia. We have a woman here in San Diego who recently pleaded guilty to sending money to Al-Shabaab. But no one has been prosecuted. Not one bank has been prosecuted for participating in these wire transfers. What's your response to this decision, and what effect is this going to have?
Well, my response to this decision, I think, is hasty. It needs to be reassessed to look at the implications that it has. The magnitude of the famine in Somalia was about 3.2 million people are affected in southern Somalia. Now, these people, most of them did not have family in the diaspora that was sending them money. Now what you're going to have is a situation where 6 to 8 million people will be affected because they have people back home that have left the country. So these people, these 6 to 8 million people, may in effect a famine may happen from that as well. So the implications and the magnitude of it on a humanitarian level is of epic proportions. So we have to understand that, and we have to look at alternatives. And at the moment, there is no present alternatives.
Why aren't there any alternatives? As I understand it, the majority of the money that is sent to Somalia is done through these informal money transfer businesses called hawalas. Is it possible to say, send money through a bank from the United States to country B, and then country B sends money to Somalia? Is that a possibility?
Well, that requires a lot of, situations where you have to have people in country B to do that. At the moment, we have a situation where we're trying to get food and assistance and money to people in remote villages in the most scarce parts of the country. How can that be done with a bank? You don't have Wells Fargo, Citibank, or Union Bank in the villages of Somalia. You don't have that, but you have these wire transferring, hawala systems that operate over there. So in order to help with the humanitarian assistance, in order to help people live their lives based upon remittances, $100 million worth, just from this country alone, you have to have these hawalas in order to function properly.
So the hawalas depend on the banks?
Absolutely. In order to function as a hawala, you have to use a banking system.
So who's to blame here? Is it the banks for acting too hasty? Is it the U.S. government for not creating a system where maybe these banks could have greater scrutiny over the money? Is it a few bad apples within the Somali community? Who's to blame?
Well, I wouldn't mention the blame as much as I want to mention the solution. The solution is something as simple as sitting down. The senators and congressmen, our government officials sit down with these banks, and we also sit down with the Treasury Department, and we sit down with these hawalas and say, okay, how can we do this? The option of cutting the hawala system off is not something that's possible. It's something that will have negative implications on all fronts possible. So what's the alternative? What can we do to tighten up security? What are some of your concerns on this end, and what are your concerns on this end? And then we figure out and we negotiate a solution that's effective, because like you mentioned, a few bad apples shouldn't be the result of 100 million people.
Very quickly, you went to Somalia this summer to hand-deliver aid to famine victims. What are you hearing about the conditions there on the ground now?
Well, the conditions are very horrible. There's been rainfall in the southern parts, but taking the internally displaced people, just the IDPs, back there is difficult in the moment. But we are trying to do work over here. January 14th, we have a 5K walk at Mission Bay. More information can be found at solsandiego.com. And the situation is very sad at the moment.
Okay. Abdi, thank you so much for speaking to us today.
Thank you.
A look at restoration of San Diego's South Bay following more than a half-century of commercial salt pond production. And what's stopping California from fully implementing healthcare reform? Those stories and much more coming up. This is KPBS Evening Edition.
Tonight on KPBS at 8, Mexican, Chinese, Italian, and Jewish holiday traditions are explored as Chef Lydia celebrates America, holiday tables, and traditions. Then at 9, see how residents connect to our region's past by living in historic homes on San Diego's historic places. And at 9:30, learn about San Diego's old cemeteries on another edition of San Diego's Historic Places. All tonight on KPBS.
Hi, I'm Elsa Sevilla. If you find yourself hearing about a great program on KPBS after it's already aired, we have a solution. Get notified about your favorite TV programs on KPBS before they air by subscribing to the TV Highlights email alert. This daily email will feature the best programs coming up right here on KPBS TV, so you can make a date to tune in or plan to record it. It's easy to register. Just go to kpbs.org/alerts.
KPBS Evening Edition is made possible by Joan and Erwin Jacobs and by
As the year comes to a close, we thought we'd bring back some of the best enterprise stories of 2011. San Diego's South Bay is being restored following a half-century of commercial salt pond production. KPBS environment reporter Ed Joyce takes a boat ride to bring us this story.
For more than 50 years, a 200-acre section of South San Diego Bay was cut off from the rest of the bay, choking the natural tidal flow. But now, that's all changing.
We're at the far south end of San Diego Bay. We're on the San Diego Bay National Wildlife Refuge. And in the last 2 months, as part of the restoration project, we've cut open the levee that separated these ponds from San Diego Bay.
And once the tidal flow started returning, so did thousands of birds, fish, and other wildlife.
So essentially you've restored this section of the flats from the salt activity to more of a living, vibrant, natural seawater habitat.
Right, by reconnecting them, it really let fish move back into the ponds freely, migrate back and forth, and create the conditions where we're going to get large numbers of shorebirds and seabirds moving into this area.
A few months after the levees were breached, egrets, sanderlings, pelicans, herons, marbled godwits, and other birds were flocking to the revitalized marsh habitat. To get a closer look at the South San Diego Bay Restoration Project, we're going to take a trip on this boat.
So we're now following some of these channels that we cut in here in Pond 10, and as the tide rises, these exposed mud flats will get covered over, and some of these areas you can see we've head started with cordgrass, and the idea is that this will be an area where the cordgrass will take root and then expand over time and become habitat for the endangered light-footed clapper rail.
Adding the new salt marsh vegetation provides a welcome home for the endangered clapper rail. Much of the bird's natural habitat has been swallowed by development and urban growth.
Hi.
Holly Henderson is one of several people wading waist and chest deep in mud to plant plugs of cordgrass.
So what we just planted here is we have 10 plots of cordgrass that are going to be study plots for the next several seasons of growth. And so this is the 7th one we've put in today, and we have a total of 10 that we're doing. And they're in pretty muddy areas, as you can see.
So you're knee-deep in this?
Yeah, knee-deep's pretty good. Sometimes we have to crawl, and we use the black buckets as sleds, kind of, to push us through. So we put plants in them, and then you kind of crawl through and do your planting.
Biologist Chris Norby, a project consultant, has watched the area come to life.
This is a new depression that's forming that way, and a circular, semicircular feature right here goes around and comes out up there. So that's all happened in 5 weeks. This was all essentially a level marsh plain, and now it's already starting to show some diversity in the topography. So it's pretty exciting.
There's still more work to do before the project is finished, but the work so far by humans and nature has already brought life back to this portion of San Diego Bay.
KPBS environment reporter Ed Joyce. The replanting of the marshes ended earlier this month. The project cost $8 million and included 2 other sites, the Chula Vista Wildlife Reserve and Emery Cove. Almost 300 acres of marsh wetlands are now restored in the South Bay. Acidification in the oceans caused by climate change is affecting some organisms much earlier than predicted. Some of the acidity levels weren't expected until the year 2100. The findings were published today by scientists at Scripps Institution of Oceanography. So what's stopping California from fully implementing health care reform? KPBS reporter Kenny Goldberg joins Amitha at the Evening Edition Roundtable to talk about that and much more.
Prescription drug abuse and health care reform, those were just some of the big topics on the Health Beat in 2011. Joining us to discuss these and other stories is KPBS health reporter Kenny Goldberg. Kenny, welcome. Just last week, you brought our attention to prescription drug abuse, which is being called the fastest growing drug problem in America. How big of a problem is it in San Diego?
Well, we've seen an enormous rise in prescription painkiller abuse in San Diego as well as the rest of the country. We're talking about drugs like Vicodin, OxyContin, morphine. And what we've seen in San Diego in the past decade, there's been an 85% increase in accidental deaths from these kind of prescription painkillers. And I spoke to the deputy medical examiner in San Diego. Here's what he had to say about it.
Most of the deaths that we see are people in the age range of about 40 to about 60. And these are the people that generally have problems like chronic pain. And they have a legitimate reason to have these medications, but they may mix or borrow or overtake their medications more than prescribed.
Kenny, how did this whole problem of prescription drug abuse, painkiller drug abuse, even start?
Well, about 15, 20 years ago, health officials decided to address chronic pain. It's a big problem in doctors' offices. People have back pain, knee pain, stuff like that. And so they wanted to educate doctors about how to treat chronic pain and get them to pay more attention to it. And then at that point, some of these new painkillers came on the market, and now we've got a big problem with them.
So are these drugs inherently bad?
Well, doctors say not necessarily. I spoke to a pain specialist in Encinitas that prescribes narcotic painkillers to his patients all day long, and here's what he had to say.
They provide tremendous assistance for those people in chronic pain. So used correctly, they're wonderful. So it's hard to put a judgment call on the narcotic themselves. It's how they're utilized and the people that use them.
So what steps are law enforcement officials taking to curb this drug abuse?
Well, they want to re-educate doctors, if you will, on how to properly prescribe pain medication for patients. Pain specialists like the doctor we just heard from, they're educated in that area. But your regular general practitioner, primary care doctor, they don't get much time and education in medical school about how to prescribe narcotic painkillers. So there needs to be more education out there. Also, what officials are doing is they're trying to get people to give back their unused prescription drugs. In San Diego County, at all the sheriff stations and at 2 police stations, they have these permanent drug collection boxes where people are encouraged to bring their unused prescriptions in, no questions asked, just dump them off, and then they incinerate their drugs to try to get some of the excess supply out of the system.
And what kind of response are they getting?
Quite good. A couple of times a year they have these national drug take-back days. We're having one, I think, in April. And they've collected in the past couple of years in San Diego County, I think, just thousands of pounds of drugs.
Moving on to another topic, one of the big stories of 2011 was health care reform. Some provisions have already kicked in. What are there, and what's coming up next?
Well, some of the provisions that have already taken effect are adults can have their adult children on their health plans until they're 26. Preventive services like well baby checkups, breast cancer exams, prostate exams, those are provided at no cost to people who have insurance now. The big thing that's coming up in 2014, a couple of years from now, will be everybody will be required to have insurance, either have it provided to them by their company or they'll be required to purchase it. And in California and other states, there will be a health insurance exchange. It's an online marketplace where people will be able to go on and shop for plans, shop for discounts, compare plans, and that kind of thing.
Okay, and how big of an effect is that going to happen? Because one of the main purposes of healthcare reform was to lower the cost of health insurance. How effective is that going to be?
That's an excellent point, because in California, here's the rub. In California, state regulators are not allowed to control the price of health insurance, unlike in other states. In about 3 dozen other states, regulators have the ability to reject price increases they consider excessive. That doesn't take place in California with health insurance.
Okay. Kenny, thank you so much for speaking to us.
Thank you.
Coming up in the public square, reaction from San Diegans about whether Congress is doing its job. Today, House Republicans rejected an extension of the Social Security payroll tax and long-term unemployment benefits. This is KPBS Evening Edition.
I'm Gwen Eiffel. On the next news hour, political deadlines loom as the campaign pace picks up in Iowa and a showdown builds between Congress and the White House. That's Tuesday on the PBS NewsHour.
Next time on Nature. Yellowstone in winter. A breathtaking world in white. This is no ordinary place. Enter a winter wilderness and experience the magic that is Christmas in Yellowstone.
Wednesday at 8 on KPBS.
The American people have named PBS
the most trusted source of news and public affairs
for the 8th year in a row.
Trust.
The American people have spoken.
Thank you.
Welcome back to the Public Square on KPBS Evening Edition. Today, House Republicans rejected a 2-month payroll tax cut extension. Now, more than 160 million Americans can expect to see cuts in their pay starting in January. The tax breaks come out to $1,000 a year for anyone earning $50,000 annually. What do you think of the decision by House Republicans to reject the tax break? What effect will this have on struggling American families and the economy? We also want to hear from you on your thoughts on Congress. The current Congress also has the worst approval rates from the public. Is Congress doing its job? On Facebook, Mandy says Congress is short-sighted and simply out of touch with the vast majority of Americans. And on Twitter, Marie says Congress is being irresponsible and self-serving. Is our government functioning as it should? And have Republicans walked into a trap by rejecting the tax break extension? Do you think they should leave for the holidays without reaching a compromise? You can weigh in on the conversation on Twitter, Facebook, and of course you can email us. And now Dwayne has a recap of tonight's top stories.
The U.S. Interior Secretary approved a renewable energy project in southeastern San Diego today. Ken Salazar approved the Tule wind project. It would be built 70 miles east of San Diego in the rural McCain Valley. Somalis living in San Diego say sending money home is now in peril. The last bank in the U.S. that handles money transfers to Somalia is ending the practice. The banks say court cases involving Somalis giving money to the terror group Al-Shabaab have made the transfer too risky. The new ready lanes for drivers traveling north from Mexico into San Diego opened today. It's intended to reduce wait times for anyone carrying high-tech-enabled ID cards. A similar lane opened in Otay Mesa in May. It reduced wait times to about 45 minutes. You can watch and comment on any of the stories you saw tonight on our website, kpbs.org/evening edition. Thanks for joining us, and happy Hanukkah. We leave you with a look at the forecast.